A rather worrying issue that parents bring to me is breathing changes, different noises they hear from their newborn or baby that make them lose their sleep. Concerns such as their newborn sounds noisy even when they're asleep, or breathing is worse when sleeping or in certain positions. And yes, it can be frightening, because there is a spectrum of breathing sounds, from snorting, grunting, squeaking, or wet sounding breathing. And these can change between one another also. And add that to when you're already tired. Your mind can easily jump to something being seriously wrong. But from someone who spent a lot of time taking care of children, let me clarify. Newborn breathing is naturally noisy because their airways are very small and still developing. And they're also predominantly nasal breathers. That is to say, they breathe through their nose most of the time, and which makes every sound louder. This is because their noses are tiny, where mucus, milk, and even saliva can sit in the back of the throat and create gurgling sounds. This is why a lot of parents come to me worrying that they notice their child's breathing changes, especially after feeds or lying flat. They even think that this could mean their child has reflux, which could be hurting their baby. Unfortunately, though, there is some truth to this worry, because the valve between the stomach and esophagus is still immature in newborns and young babies. But still, milk coming back up, like a small spit up or sitting high in the tract, doesn't automatically mean pain or damage. As a doctor, we look for babies who continue feeding, settle well, and are gaining weight. All these are great signs of a well-growing baby. Other types of sounds you might hear are grunting and straining noises. These can also be normal because newborns are learning how to poo and pass wind. This is because they tighten their tummy muscles without relaxing properly yet, which creates noise and effort. Again, this can look dramatic, especially for new parents, but believe me, it's often part of normal digestion. So when should we worry? Here are my three big reasons to worry with breathing changes. 1. When they come with poor feeding, which is a sign of poor growth. 2. If breathing changes are associated with color changes, especially long spells, this could be a sign of respiratory or neurological issues. And 3. If there is persistent distress. As a healthcare professional, we would always want to rule out reversible causes for this, such as a foreign object causing an obstruction. But if your baby is pink, feeding well, and settling between episodes, then chances are that things are still going well. And if you think you're alone with the worry, I have a lot of babies referred to me from other doctors purely for breathing noises who thankfully turn out to be completely healthy. But hopefully by now you can find some reassurance, because now you know most strange breathing sounds can be explained by anatomy and physiology changes. In the next chapter, we'll talk about sudden behavior changes, because that's another worry parents come to me with and is not talked about enough.